Case report, reimplantation of avulsed maxillary central, 21, and lateral, 22, incisors in a 20-year-old patient. Abstract. Tooth avulsion represents one of the most severe traumatic dental injuries, especially in the anterior maxillary region. This case report describes the clinical management of a 20-year-old patient who experienced traumatic avulsion of teeth 21 and 22. Immediate reimplantation, careful handling of the periodontal ligament, endodontic therapy, and structured follow-up protocols contributed to a favorable prognosis. The report highlights evidence-based procedures, post-operative care, and long-term considerations for successful outcomes. Introduction. Dental trauma is a prevalent issue, particularly among adolescents and young adults, with the maxillary anterior teeth being most susceptible due to their prominent position. Avulsion, defined as the complete displacement of a tooth from its alveolar socket, accounts for approximately 0.5 to 16% of traumatic dental injuries. Immediate management significantly affects long-term prognosis, as the survival of the periodontal ligament, PDL, and pulp tissues is critical. Factors influencing prognosis include extraoral dry time and storage medium, patient's age and root development, handling of the tooth before reimplantation, systemic health and oral hygiene. The International Association of Dental Traumatology, IADT, guidelines recommend immediate reimplantation whenever possible, optimal storage and physiological media, gentle handling of the root surface, and subsequent endodontic therapy. Case presentation. Patient information. Age, 20 years. Sex, male. Medical history, non-contributory. Trauma history, the patient presented after a fall during sports, causing avulsion of teeth 21 and 22. Clinical examination. Extraoral, mild swelling, no facial lacerations. Intraoral, empty sockets at 21 and 22, bleeding controlled with gentle pressure. Adjacent teeth intact. Radiographs, confirmed empty sockets, no alveolar fracture. Initial assessment. Extraoral time, approximately 30 minutes. Storage medium, tooth kept in milk during transport. Diagnosis, avulsion of maxillary left central and lateral incisors. Step-by-step procedure. 1. Preparation and patient consent. Informed consent obtained after explaining risks and benefits. Local anesthesia, 2% lidocaine with 1:100,000 epinephrine. Aseptic protocol established. 2. Tooth handling. Gentle handling of the teeth by the crown only. PDL remnants preserved as much as possible. Rinsed with saline to remove debris, no scraping of root surface. 3. Socket preparation. Sockets irrigated with sterile saline. Hemostasis achieved with gentle pressure using sterile gauze. Any coagulum carefully removed to allow reimplantation. 4. Reimplantation. Teeth repositioned gently into their respective sockets. Correct alignment verified clinically and radiographically. Splinting with flexible wire composite splint applied to adjacent teeth.
I did the splint, and now the patient is going to come after 6 weeks. I'm going to remove the flexible wire and splint, and the medicine I write 5 days is going to eat. Soft diet, also eat first week, and specially care. Oral hygiene is going to improve. The patient reported will be report after 6 weeks. In second week also is going to come for review. Everything is going to successful. Patient is very happy and parents with came is very happy. This is unbelievable. The procedure I did, the patient is happy and successful rate is the about to 100%. Thank you very much to watching.